Hi, Vanna Reisman here to talk about the most common vaginal infection, which is bacterial vaginosis, which I'm sure we've all had at one point in time. So this is a change in your pH level, and it's estimated that 75% of women who present to their provider are diagnosed with this. So it can mimic like a UTI or STIs, but it really is bacterial vaginosis. And what that is that in our vaginal area, we have something called lactobacilli, which are the good bacteria producing this lactic acid. So it keeps our vaginal pH at a very low acidity. So it's 4, which is very similar to, like, say, white vinegar. That's how acidic we are down there. But that's normal for us, so that's okay. But there are certain things that can change that pH level, such as ejaculate from semen and blood are also basic elements. So when you mix those together, it can change the pH levels. So if you're having a lot of sex or you are bleeding more than usual in your cycle, you can have trouble maintaining your normal pH levels. And other things are antibiotics can cause can kill off the lactobacilli, and so you really have to go to the doctor or the provider to get diagnosed, because culture has to be taken to determine if you have something called Gardnerella vaginalis, which is what the medical term is for that. And once it's been diagnosed, then there are different treatment options. Unfortunately, there's nothing over the counter to treat this. There is boric acid suppositories that people use to be able to maintain your pH, which is okay, but it typically has to be treated with gels or an antibiotic. So you need to go to your doctors and get seen for this infection. So I'm hoping that this helped to understand the very common bacterial vaginosis. If you have any questions or comments, please post below. And if you have if you need to see your provider for any medical advice, please do that. Thank you. Bye.